Welcome back, everybody, to the OPT Network. This morning, we're talking about the importance of our eyes and keeping them safe. And here to talk about that this morning is Dr. Richard Walters. He is an optometrist at Louisiana Eye and Laser. Dr. Walters, good morning and welcome back.
Good morning. Good to be back.
So October is Eye Injury Prevention Month. Who knew? And so why is it important that we understand? I don't necessarily knew that I ever thought we needed to understand injury to eyes. Why is that important?
Eye injuries occur every day, and they occur when people least expect them. It could be something that occurs on the job. It could be something that occurs at home. Simple little activities that you do can cause serious eye injuries, and they happen just in a moment's notice without any warning. It could be working in your garden and get poked in the eye. It could be using a weed trimmer in your yard and have trash blow up in your eye. It could be riding a four-wheeler out for recreation and have something blow in your eye in the wind. So eye injuries happen all the time, and in most cases they happen when they're least expected.
I think that's why this conversation is so important, because we just take for granted that, we see people doing their lawn all the time. Most people or many people don't necessarily use eye coverings. Our kids are playing out. And so what are the ramifications of something getting in our eye? Could it create serious problems, or is most of the time it just very innocent?
It can, and you'd be surprised how many times patients will come in with an eye injury and they reported that they were at home working in their workshop or using a power saw or some type of lawn equipment, and they comment all the time, I had a pair of safety glasses, but I just didn't put them on this time. Mm-hmm. And then that's when the injury occurs. And it can cause serious consequences, anywhere from a minor abrasion to a very serious eye infection that could threaten loss of vision.
Wow. And so sometimes do people self-medicate as opposed to coming in to a doctor?
Many patients will try to resolve the problem themselves, mm-hmm. and that can be irrigating the eye, putting some drops in like Visine or Murine just to try to remedy the problem, and oftentimes that won't help. If there's an item embedded in the eye, many times it has to be removed by their eye doctor.
Really? And so if you get something in your eye, sometimes you can't get it out.
Oftentimes you can't get it out. It could be embedded in the front surface of the eye, like a piece of metal or some type of debris, or it could be trapped up under the upper lid. And the upper lid is very soft, and when you blink, it scratches the eye. Again, those types of things are easily removed by the eye doctor, but difficult for the patient to do.
And so if something like that happens, Dr. Walters, and you get something lodged in your eye, what are the chances that it will damage the eye, or does the eye heal itself somehow?
It depends on the type of foreign body. If you get a piece of material, like a little piece of a wood chip or something like that up under the upper lid, it typically will scratch the eye when you blink. Once you remove the foreign body and cover it with antibiotics so that the eye has a chance to heal, often that'll heal without any permanent injury. Mm-hmm. However, if you get a piece of metal in your eye from using a grinder or some type of power tool, often that can be removed and it will heal, but in most cases it will leave a small scar where it was removed, depending on how deep it is. If that's in an area of the cornea that's not used for vision, it doesn't have any dramatic vision consequences. If it happens to be very close to the line of sight, it could cause a permanent loss of vision.
Mm-hmm. Let's talk about those people who wear contact lenses to add to that, and they're not using any kind of protective covering. Because I know that over time, sometimes when you wear contact lenses, that lens can go up in your eye and get lost.
And sometimes a lens will have a tear on it or have a nick on it that they're not aware of. And wearing that contact lens will actually abrade the cornea. So the contact lens feels very uncomfortable. So they'll take it out frequently, try to rinse it off, clean it off, see if that makes it more comfortable, but they put it back in and it starts bothering again. Sometimes there's even a tear in the center of the contact lens. Because remember, that contact lens is a soft, pliable material. So as you're cleaning that contact lens at night, or sometimes when you're taking the contact lens out, if your fingernails are too long, they will actually cause a cut in the material, which will ultimately cause the lens to tear.
And so if that tears, how dangerous is that to the actual eye?
A torn soft contact lens is dangerous to the point that it can cause a scratch or abrasion. The good news is once they take the contact lens out and they're treated properly by the eye doctor with the appropriate medications, many times that will heal without permanent vision consequences. The biggest issue with contact lens wear is not cleaning them properly, and the eye develops an ulcer on the front surface under the contact lens. That's a much more serious condition, and without treatment can lead to permanent vision loss.
An ulcer on the eye?
An actual ulcer on the eye caused by the contact lens.
And so is that painful? And how would you know if you had an ulcer?
It is painful. The patient wouldn't know if they had an ulcer unless they came into the office. But what they would come in with is my eye is hurting, my eye's red, my contact lens is painful, my vision's blurry. They know something's not right in that situation.
Mm-hmm. And so as with not just the month of October, but really protecting our eyes every day, all month and all year is critically important. But you know, until we have conversations like this, Dr. Walters, we don't really realize how important and how vulnerable our eyes can be sometimes.
That's exactly correct. And another item that is a common cause of injury is household chemicals. Household chemicals can be in the form of acids or alkalis. And oftentimes, just in handling those chemicals in your normal cleaning activities, it can splash in your eye. And it can cause serious injury. Acid type products that have a very low pH typically cause an immediate reaction, and the treatment is to irrigate the eye very, very well and then see your doctor immediately. Mm-hmm. Other type of cleaners, alkali type cleaners, have a very high pH, and those cause serious damage to the eye, and oftentimes irrigating it is not enough. The chemical can continue to cause problems with the eye and serious risk of vision loss.
And especially now that we are still in the midst of COVID-19, I know myself personally and probably a lot of other people who are using household items. I'm using more Clorox now.
Absolutely.
Than ever before. And sometimes when you mix chemicals, that can create problems, and that just the aroma of it, will come up and hit you in the face.
Absolutely. Common reactions.
Mm-hmm. And so what's the most important thing, Dr. Walters, do you think that we need each of us to know about taking care of our eyes? Because as we get older, our vision changes, everything changes. Is there a way to protect our eyes?
When you're doing an activity that you think could likely cause an injury, and it could be riding a four-wheeler, okay? Believe it or not, I've had patients riding a four-wheeler that a bug hit them in the eye.
Funny you would say that. I was out with our kids riding a bicycle and a bug flew right into his eye.
Absolutely, it happens. And riding a bicycle is not as bad as if you're doing a four-wheeler at full speed.
Right.
Or a motorcycle. Mm-hmm. And so doing those activities, especially when there are lots of insects flying around, make sure you wear some type of safety protection. If you're working in your garden, many times they're gardening around plants that have little stems and things like that. And you'll actually lean forward trying to do something with a plant, and another plant stem will poke you in the eye. So just little activities. If you're using power tools, grinders, yard equipment, those types of things, think safety. Think about wearing eye protection so that something doesn't cause an unexpected injury.
There you go. And how often should we have our eyes checked up on?
It's recommended that most people have yearly eye exams just to maintain the good health of their eye and good vision.
Dr. Walters, thank you so much for taking the time. Before we've got to let you go, tell people how they can connect with you and all of the great physicians throughout Central Louisiana, and how we can connect with your website.
Great. Our website is louisianaeyeandlaser.com. And our phone number is 318-487-2020.
There you go.
And they can reach us through our website, and they can reach us through our phone number. We have 15 locations throughout central Louisiana, and we're more than happy to see patients and help them with these problems.
There you go. Thank you, Dr. Walters, for taking the time. We know just how busy you guys are.
Thank you very much. I appreciate this.
Indeed. Hey, everybody. Dr. Richard Walters, optometrist at Louisiana Eye and Laser. Stay on point. We're back after this.